good morning. I am Rosebud Comilang, and for today we'll be going to do the Sitz Bath. So for the preparation, first we need to review the medical order, the frequency, and the length time for the procedure. So we need to review the medical record. It is to ensure that the right medical order will be applied to the right patient. Next is to review the frequency and length of the time for the procedure. It is to provide safetiness for our patient. So second is to gather all the equipments needed and bring them to the bedside or the table on the bed of the patient. Next is to assemble all the equipments needed. We have here our equipment. So assume that this is the Sitz Bath tub. We have here alcohol. Then we have here a pair of gloves, a thermometer, a towel. So this is the bath blanket. So we have here our patient. Then assume that this will be the irrigation bag. So we have here our rubber mat and then the bath mat. And then assume that this is the footstool. So let's go to the procedure. So next is to introduce yourself and verify the client's identity and explain what you're going to do to your patient and why it is necessary. So good morning, ma'am. I am Rosebud Kumilang. I am your nurse for today. So can I ask your full name, ma'am? Okay, great. So for today, ma'am, we're going to do the Sitz Bath. It is to lessen any pain or discomfort that you are suffering right now. You will sit under a warm water, and it consists of 15 to 20 minutes. So after that, you can back to rest, and I will clean everything and bring them to normal. Okay, great. So next is to perform hand hygiene. It is to avoid any cross-contamination. So I have here alcohol, but we make sure that we will be hand washing. So next is to provide the client's privacy. So assume that I will be closing the curtains now, any windows or doors. Next is to remove all the jewelries you have, including your watch, and then put the gloves and face mask. So I am ready now. So for the next step, we will be going to place the Sitz Bath tub on the toilet and fill it with warm water. Then we will check the temperature. If it is okay to the patient, the warmness of the water to the patient. So assume that this is filled with water now. So we will check the temperature. Okay, it is on the 38 degrees Celsius. So we will ask the patient if it is okay to the warmness of the water for her. So ma'am, can you check the warmness of the water? It is okay, the warmness to use. I will assist you, ma'am. So it is okay? Okay. So next is we will be going to place the irrigation bag to the IV hole. So assume that this is the irrigation bag and this will be the IV hole. Then we will be placing it here and then clamp the tube. Okay. So next is to assist the patient to sit here under our warm water or here in the Sitz Bath. So mama will assist you to sit here. Okay. So on 3, 1, 2, 3. So next is to put extra dripping for the patient to provide privacy. And easily unclamp the irrigation tube. And to check if there's any pressure on the thighs of the patient, so we can provide a footstool. So ma'am, are you comfortable with your position or do you want me to provide you footstool? Okay, perfect. So assume that this will be our footstool. Is there any pressure on your back so we can provide you any towel to relieve your pressure here? Okay, perfect. So I will have here this towel. So this is to relieve any discomfort in your back. Okay. So ma'am, this is the clamp. So if the water becomes cool, you will just unclamp this to ensure that it will be okay. So ma'am, this is the call bell. So if you feel any discomfort or dizziness or fatigue, don't try to stand up and just reach this call bell here on your side and press it. Then I will be there for you. Okay. So next is to observe the patient for any signs of fatigue and dizziness. Also, we can provide a cold compress to her neck or in her forehead. So ma'am, do you want me to put a cold compress on your forehead or on your neck? Okay, we can do that. We will put this cold compress on her neck or in her forehead. Is that comfortable? Lessen your pain? Okay. So, we'll continue doing for you. So next is to remove the gloves and perform hand hygiene. So after 15 to 20 minutes, the patient is finished. So we can put our gloves on back and we will dry the perineal area, just patting it and dry it gently. So ma'am, can you please stand up or do you want me to just assist you? So it's been 20 minutes and you are finished. So I will gently pat your perineal area and dry it thoroughly. So I will remove the drape. So ma'am, stand up on 3. 1, 2, 3. And I will dry your perineal. Next is to assist the patient to go back to her bed and rest. Then next is to remove all the PPE or gloves and perform hand hygiene. It is to avoid cross-contamination and for your safety and for your patient safetiness. And then next is to document any pertinent data, any sign and symptoms of any complications. So we need to document all of that. So that will be all. Thank you.